Welcome to an informational session on the Clinical Mental Health Counseling Program at Eastern Oregon University. As I mentioned earlier, my name is Dr. Hope Sherman and I am the program director. I'll be talking to you some as well as our practicum and internship coordinator, Dr. McNichols, and then we will have time for questions at the end. So a little bit about our program in general. We do not require a specific undergraduate degree, just that you have completed your undergraduate. We also do not require a specific GRE. However, we do factor that in as a weighted part of your application. We admit 3 times a year in fall, winter, and spring terms, and those starts typically in September, January, and then early April, late March for spring term. And we admit up to 25 full-time equivalent students because sometimes graduate students are part-time. That may look like cohorts around 30, just depending on the makeup of that particular application pool. Students can choose between different plans of study. We have a 2-year option, which is the fastest way to the degree, and a 2.5-year option. I'll show you a sample of the 2-year plan in just a moment. The 2.5-year plan just takes the 2-year plan and extends it 2 extra terms. And so that would be 10 terms total. Our program is all terms throughout the year, and so it's a little different from undergraduate study, where sometimes summers might be optional, and graduate school, if you want to finish in, kind of a shortened timeline, you do go to school in the summer term. Something that's unique about our program is we don't have any in-person courses. We do our residencies and our synchronous work on Zoom. And that allows for greater flexibility and also for students to not have to travel or take time off from work to attend residency. Our classes are about a 60-40 split between asynchronous and synchronous work. And so many of our classes are fully asynchronous, meaning that you don't have to meet at a specific time each week with your synchronous class. We have 5 classes that are synchronous, but don't meet weekly, have varied meeting times. And then at the end of the plan of study, when students move into their clinical coursework and they're at sites doing counseling, they do meet weekly for their group supervision courses. We're a very community-focused program, and I think that's something else that sets us apart as an online program. We work very hard and very intentionally to create community within our student population and with our faculty members. And so lots of classes will have group work or partner work, role playing, getting comfortable with counseling skills, working together as professionals. We do informal coffee talks with professors pretty frequently, where a professor will bring a topic to students who want to attend on Zoom and kind of talk through that topic. It's often a specialty area of interest, such as gaming or eating disorders or other topics. And then our students have meetings, inter-cohort meetings without faculty where they can support each other. They also have an inter-cohort Discord, and we have a wonderful group of students called the Student Ambassadors that work to organize community among our students. Our program is trauma-informed and rural serving, and we also focus on looking for and applying for grants for student scholarships. At this point, we've had 3 terms of students who have graduated, and 80% of those report having jobs obtained in counseling prior to graduation, which is a pretty exciting statistic. This is our mission statement. It's available on our website and in our handbook for anyone that wants to spend some time with it. I'll take a moment to highlight some of the areas that I think are different or unique about our program. We have a strong focus on preparing future counselors to work both ethically and be exemplary counselors, working through a trauma-informed lens, and also viewing students through holistic and systems-informed perspectives, meaning we don't ascribe to the medical model where we're looking to cure a person of an issue, but we're looking at the whole person and how they're affected by many different components of their lives. We are aligned with the 2024 Council for Accreditation of Counseling and Related Educational Program Standards, which we call CACREP. And we educate our students to be advocates, invest in social justice, and collaborate with communities and individuals across societal and personal challenges. And then one thing that I think is very unique about our program, but also about Eastern Oregon in general, is that we have a focus on rural populations. And within the CMHC program, we like to say that we are preparing our students to be mental health emissaries with a charge of bringing mental health services to rural and underserved populations, which is such an important component of our kind of where we are situated within Oregon and within the Western region. So this is an example of our 2-year sequence. You can see in the first year, students take 3 courses every term, and in the second year, they take 2 courses every term. The only difference between this and the 2.5-year plan is that every term, 1 through 10, the students take 2 classes from start to finish. You can see at the end here in term 6, 7, and 8, we have 3 different clinical course sequences. So that starts with 650, which is practicum, 660, which is internship, and 670, advanced internship. And during that time, you will be working at an actual counseling site, earning hours towards your graduation. And in just a moment, Dr. McNichols will talk more with you all about the clinical coursework piece. I do want to say just a little bit about accreditation because often folks come into these sessions wondering about accreditation. I mentioned CACREP earlier, and CACREP is one of the accreditors for counseling programs. We are CACREP aligned right now, but not CACREP accredited. And the reason for that is because you have to have graduates before you can apply for accreditation. Our first set of graduates were at the end of summer term this last year, so in September, and we submitted our application for accreditation in December. So right now we are in process of getting our accreditation. And that is sort of a lengthy process. It's multi-steps. And the good news is that CACREP typically backdates accreditation to when the program applies for it. So we're in process and we feel good about everything that we've submitted so far. That often leads to the question, though, of are graduates able to get licensed? And the answer to that question is yes, they are. In fact, most of our graduates are already in process of being licensed professional counselor associates or interns based on whatever state they are in. So we don't take students currently from the 13 states that require active CACREP accreditation. And those include Illinois, Kansas, Missouri, New Jersey, New York, North Carolina, Ohio, Virginia, and Wisconsin, and a few others. And we keep that information on our website for anyone that's interested in it. So our plan for accreditation is to keep doing what we're doing, to stay aligned with the standards, collecting our data, responding to CACREP as we get feedback on our self-study, and just working the process until we are accredited. That is our end goal. All right, Dr. McNichols.
Yes, thank you. So as Dr. Sherman mentioned, during the last 3 terms of the program, students work in their communities, providing counseling services to people within their local communities. So this clinical experience portion of the program is really the opportunity and the chance to take all the content that the students have learned in the more content-based classes and apply them to work with clients. So students will work in a variety of different places or settings. We have students at hospitals, behavioral health hospitals, schools, prison systems, nonprofit organizations, and even private practices. So students can choose where they want to do their practicum and internship experience. It does have to be at a place where you can gain experience providing counseling, but also be supervised by a licensed professional or someone who's licensed to practice independently within your state. So it's an exciting time in the program. You really get to do that hands-on work, and really it's the preparation for when you graduate and pursue licensure. The first class that you take is called Practicum, and it's 100 hours of experience. And this experience is divided into direct counseling hours and indirect counseling hours. So the direct counseling hours are basically anytime you interface with clients or work directly with clients. And then the indirect services are all the things that counselors do behind the scenes, like developing treatment plans, preparing for sessions, doing professional development, preparing treatment plans, things like that. Once students finish practicum, they move into internship. And so the first internship class is 300 hours of experience. And some of those hours are gained in direct counseling and others in indirect. And then there's the third class is the advanced internship, which also has the same breakdown of direct counseling hours and indirect client services or indirect services. So, as far as kind of help with this process or this portion of the program, I'm the placement coordinator for the program. So I work with students to provide information about the steps kind of leading up to getting prepared for this, finding a site, getting connected with a site, filling out all the paperwork that has to kind of go into that. But also making sure, helping that it is a successful experience and that you have what you need to learn and grow and thrive during this important phase of the program. So I work closely with students with one-on-one meetings, but also group advising to help facilitate this process.
All right, so I thought we would just briefly go through some of these commonly asked questions, and Dr. McNichols, please feel free to jump in here. How is counseling different from other related fields? And if we're looking at master's level clinical positions, this is going to be mostly like master's in social work programs because there are some master's in psychology programs, but those tend to be tied to or tied in with PhD programs. So one of the differences in the counseling profession, I will say, is that counseling as a profession believes in a holistic model and viewing clients holistically. We do use the DSM and diagnose clients, however, that's used through a different lens. Dr. McNichols, would you like to add to that?
Yes, and I think too, counseling really stands out because there is a focus based because of the history of counseling, a more of a focus on prevention, so preventing the development of problems for individuals, families, couples, um, and also the importance of human development over time, how people grow and change as they move through life, and then also multicultural practice and social justice practice as well.
Yeah, I agree. Thank you. And counselors work with so many different concerns, issues, populations, anything from kind of your, I think what many people think of as counseling, like you go to a counselor and you talk to them about maybe your relational issues or choosing what you want to do with your life. So those sort of everyday struggles that many of us deal with, all the way up to including, serious diagnoses and working in hospitals and things like that. So lots of settings and lots of populations that one can specialize in. So how is this program different than other online counseling programs? I think I touched on that earlier with our focus on community, our a focus on rural populations and being trauma informed. One thing that comes to mind to me also is the faculty student relationship. So every student has a faculty advisor. There are 7 of us, and we really strive to have good relationships and strong relationships with our student advisees and make sure that they know, even though we're an online program, there's always someone that they can jump on Zoom with or get on the phone with to have that important, actual talking sort of face to face. So that to me is pretty different. How about you, Dr. McNichols?
Yes, I would agree. And another thing too is that the faculty that work here, we have actually known each other in various capacities for a long time, and I think it really does reflect in the program that we've developed and put together and the way that we work together. And we're all very experienced and passionate about people coming into the field and coming into the profession. And so that's an important piece of that. And I hope students kind of experience that as they move throughout the program. But also just that emphasis too on rural practice, on perhaps thinking about things or seeing things through a different lens based on where you might be located. And so I think for many students, this program allows an access to education, to counselor education, but also that, I think in many of our courses, you'll read articles or we'll have discussions that really focus on how this may be different or might look different in the rural setting.
Yes. I agree. And I do think, as far as our faculty goes, I've never worked with a team that cares so much for students. Like they just really work hard to make sure students get what they need and are successful and are taken care of. So will I be able to be licensed once I graduate, and do faculty help students prepare for licensure? Yes, if you are in one of the 39 states from which we qualify for to meet the educational requirements for licensure, you will be able to get licensed once you graduate. You will have all of the educational requirements for licensure as a licensed professional counselor or a licensed mental health counselor, depending on what your state uses as their title and acronym. And faculty do help prepare students for licensure. We have many resources in our courses to help students with that. We also help with licensure forms and answering questions both before and after graduation. The next question is, will there be ways to connect with other students and faculty? I feel like I talked about that all already, but did I leave anything out, Dr. McNichols?
No, I think that one thing that we kind of do that within classes too is because all the classes are online, we use Canvas as our LMS, and we usually always have weekly discussions that students can participate in. So you get to know each other, you get to share your views, talk about research, things that you're reading, things that you're learning. And then there's also opportunities to do group work or practice your skills together with your partner or those types of things. And so even those are kind of more within the classes themselves. It's a wonderful way to get to know members in your cohort and to grow together and kind of go through the program together, which I think is really nice to have that support.
Oh, and don't forget when you guys come to campus, we always do something for our students to meet you in person if they're able to make it here.
Yes, so faculty are generally on campus twice a year. Some of us, it's usually not all of us, but either at the very beginning of the school year or for graduation. And we try to hold some sort of get together or event for students to come to when we are on campus, if you're able to. And then each cohort typically establishes their own sort of group chat so they can support each other and talk to each other, and also may join our Facebook page or student Discord. So lots of different ways to talk to each other. Faculty advising is another area that is a little different from undergrad. So as I said, every student has a dedicated faculty advisor. We communicate with our advisees a minimum of once each term over email, but oftentimes it's if the student has needs, if they need to meet, if they need to talk more, if they have additional questions, we communicate more than just that once per term. But that's sort of the minimum. And when students email us with advising questions, we're very responsive. If we don't know the answer, we find out. I actually had an advisee tell me recently that she was surprised at how fast I answered her questions because she was used to her undergrad advisor from many years ago who would sometimes not, I guess, email her back. So I like to think that we have a pretty strong advising system in place. Next, are there documents and sources of information to help guide students? Dr. McNichols, why don't you take this one?
Sure, yes. And so that's a resounding yes. Because we are an online program, we want to make sure that students have all the information that you need because we're not seeing each other constantly each week. And so in order to help organize that, we have handbooks for everything. So we have a handbook for our program, which goes through basically all you need to know about the program, the policies, the classes you'll be taking, the places for resources. So that is a wonderful resource for our students to always refer back to as they're going throughout the program when they have questions. We also have a separate manual for the practicum and internship experience, which is a similar type of document, which houses all the things you basically need to know to prepare for that experience and go through it. And then we also have a separate Canvas course, a CMHC Canvas course that students are enrolled in when they join the program. And on that Canvas course, we have things like, recordings of the student orientations. We have all the handbooks. We have help for licensure, kind of the licensure process. We have job help, so how to write a resume or create a resume for a counseling position, job sites that might have availability or places where you can look to find jobs for counselors. So we have a lot of information in that course as well. So we're very much a information-rich program because so much of it kind of depends on that communication piece since we're online. So we do have a lot of sources, and then of course the faculty are here too to always help and answer questions as you move along.
Yeah, thank you. Next, are there opportunities to work with faculty on research or other professional activities? So the simple answer to this is yes. The faculty are engaged in lots of different professional activities. We write papers, we present at conferences, and we often do involve students who are interested in that type of activity. It's not required. This is a clinical program, so we're training you to become a counselor, and we're going to teach you how to use research to inform your practice, but you don't have to know how to conduct research or participate in that. But if it's something you're interested in and you may want to go on to a PhD program, there are often faculty that have projects that students can join. In fact, recently I had a second term student join me for a webinar that we gave together. So we do enjoy working with our students who have those interests. And then our last question of our frequently asked questions is, will there be help locating a site to do your practicum and internship?
Yes. And so 2 terms before students are slated to take the first clinical class, the practicum class, you'll get an email, students will get an email from me inviting them to join in some focused groups focusing on the practicum and internship experience, talking about all the requirements, the paperwork, and kind of preparing for that. And so that's done kind of well in advance so that you have plenty of time to look for a site. And then I also meet with students one-on-one, of course, to talk about site-specific questions or things that come up about their local communities or places in their area. So you do have help. So students are not placed at sites. So you're not required to go to a certain site or placed at a site. You get to choose your site based on your community. But we're here to kind of help you do that and help you with that process. So there is plenty of support for that.
Wonderful. And I just saw the typo in that sentence that I will
Oh,
fix
yeah.
later. All right, so here is our contact information. As I mentioned earlier, we'll put this recording on our website under potential student resources. And then I'll also put a link to the slides so that if you need to pull our contact or anything else off of there, you can. The cmhc at eou.edu email address goes to multiple of us. And so depending on what your question is, if you send it to that email, one of us should be able to answer your question. So that is if there's, kind of a quick, easy email for you to remember, cmhc at eou.edu, and we can get your answers. All right, so that is all for our presentation. We'll open it up now for any questions or thoughts. Feel free to unmute yourself or use the chat if you're more comfortable with that.
I could start here. I'm wondering how things have gone with students in the past that are trying to work full-time or like part-time, like 30 hours a week while taking this program, as far as things like practicum and internships and synchronous classes go.
Yeah, that's a great question. I'll speak a little bit to synchronous classes and then I'll let Dr. Mike Nichols talk about practicum and internship. So many of our students do work full-time or part-time or something in between. Many have families that they take care of, parents that they're caretaking for, and so we are very used to students having multiple obligations. In fact, the flexibility of our program is meant to cater to students who have multiple commitments. Most of the students who work will choose the 2.5 year plan because it is a bit more manageable time wise. Our synchronous classes, both times and days, are published well in advance, like multiple terms in advance. And we also try to keep those the same days, the same times, so that even if a calendar isn't published yet, like if you know you're taking a class 5 terms from now, you should be able to look at that class this term and it's most likely going to be offered the same sort of like week 5, Wednesday at 6 p.m. is the synchronous time for this class. So we stay consistent so that our students can plan ahead. And then we're also, of course, willing to talk with students if they're scheduled to take a class and they can't make the synchronous times work. We'll usually work with them to swap it out for another class and the next term they can take the class with the synchronous times. And Dr. Mike Nichols, do you want to talk a little bit about clinical work?
Sure, yeah. So the clinical experience portion, it is similar to almost having time-wise, almost having a part-time job. So we usually kind of help students start thinking about it like that, like a part-time job, because there will be commitments on your time or times when you have to show up at your site to see clients and to get your hours. And so usually what students do is kind of start adjusting the schedule, but before they get to that phase of the program. So we do have students that are doing their practicum and internship who do work full time in another setting, but it is a little bit more challenging because they usually have to get their hours maybe at sites where they can work in the afternoons or the evenings or the weekends. And so there are sites like that because mental health is 24/7. There are sites that do provide that, but it can be a little bit harder to have to do that. Now, one thing that can work really well is if students are already working in the mental health field in another capacity or with another agency. Maybe they're in a different capacity, maybe in case management or something similar. Oftentimes they can work or negotiate with their employers to go see clients on the counseling side or to take, be able to quit their, the case management side and go over and work with clients providing counseling. So sometimes there can be a combination like that works well. So students are allowed to use their places of work, if it's a mental health facility or agency, as their practicum and internship experience. And then some students kind of negotiate with employers to maybe get certain days off. And so twice a week, to leave early or get days off so that they can make time for that practicum and internship experience. So it does take some kind of planning ahead, depending on kind of what your job or what your work looks like, to kind of make time for that. Now, another option we have, because we do offer a third internship class, advanced internship 2. And so sometimes students that are working full time or have caretaking responsibilities and they know ahead of time there's no way I can get that many hours for the internship classes, they spread it over 3 terms instead of 2. So that does extend the program. They're by 1 more term, but for some that just works better because then they don't have to dedicate as many hours to their sites each week. And then I didn't mention this, but our meetings are for practicum and internship. Our group super is always in the evenings, so we don't have any meetings during the day or during working hours.
Yeah, and yes, so thank you, Dr. Mike Nichols. I appreciate that. Did that answer your question?
Yeah, that answers it perfectly. Thank you. A lot of good information there.
Great, thanks. I see a couple of questions in the chat. So how might coursework look different in a master's program compared to an undergraduate coursework? That is such a good question. We actually cover that in our orientation because it can be a shock for students to transition from undergrad to grad, especially if they were going full-time, working full-time, and being very successful. It can feel jarring to enter a graduate program where you're reading and your course materials, videos that you need to watch, podcasts that you listen to, it's all like double or triple the time you would spend for a class in undergraduate work. And so if we use the federal definition of a credit hour, which I think is the most helpful way to conceptualize this, our courses are 4.5 credits each. And so according to the federal definition of a credit hour, that the expectation for students should be about 10 to 13.5 hours per week of class time you're going to need to look through your materials, to read everything, to watch the lectures, to do your assignments, and anything else assigned for that week. We notice that students really start to feel that difference in about the third term. Where I think in the first term, it's like, whoa, this is very different. And then by the third term, it's like, and this is hard. This is harder material to get through. So I think that's why the 2.5 year plan works so well for a lot of students because it's just 2 courses at a time versus the 2-year plan, which in year 1, you're taking 3 courses. But for many students that want to finish in the shortest period of time possible, that is the plan that they choose.
Awesome. Thank you.
You're very welcome. The next question I see, is there an opportunity to view the clinical site criteria before admission? The question is about the MSW program. I'm not sure that I could answer in regards to the MSW program. As far as site criteria for us, though, we can talk about that.
Sorry, not for MSW. I meant what you're talking about.
Oh, for CMHC. Got it. Yes.
Yeah, sorry.
Thank you. No problem, Jack. Yes, and so let me share. I'm going to share with you guys the practicum and internship manual. That's the link to it. So the manual has the criteria for sites and information about finding a site and whatnot. So in Oregon, and in Washington, if you're located in those states, you can be supervised by an LPC or a licensed mental health counselor, a licensed marriage and family therapist, a licensed clinical social worker, or a licensed psychologist. So it has to be someone that is fully licensed to practice within your state and has 3 or more years of experience. Now, the person has to be it is the site, what we call the site supervisor, has to be either an employee or a consultant of the place where you do your practicum and internship. So some sites will have very structured internships where you have to apply and go through an interview process. And then other sites, it will be a more informal process. It might just be talking with them and interviewing on the phone with them. So it kind of depends. But those are some of the main criteria. And we do kind of talk about, what kinds of activities would you be able to do? So we really want students to have a well-rounded experience. So being able to see clients from all different walks of life, diversities, concerns, age ranges, things like that. So we do encourage students to be working in the community mental health spaces. Sometimes those internships can be harder to find, but they are very rich. You learn so much from those settings. But again, we can have like a wide range of places that could serve as a site for the practicum and internship. So it kind of depends too on what's available in your area. Sometimes the larger metropolitan areas like Seattle or Portland, sometimes it's a little bit harder to find sites there because there's more competition with other students that are also looking for internships. But so it might take a little bit longer. So we do talk about, when you enter into the program, usually by the second term, you want to start kind of looking around and networking and seeing what your options might be for the practicum and internship experience. But the handbook is the manual is a great place to go to learn more about the requirements.
Perfect. Thank you.
You're welcome.
I want to add, just looking at the second part of the question around full-time employment, we do have students who find jobs in mental health that then they start work and that becomes their site. They're often onboarded as qualified mental health professionals or some version of that. And we also fill out paperwork oftentimes for students that are applying for that credential. Right now in the state of Oregon, you can apply to be a QMHP if you're in a master's program and working towards graduation. And so that's how sites are able to hire their interns as workers, and they're also getting their internship hours. So we do see that happen sometimes with our students.
Great, thank you. Sounds like a win-win.
Yes, it is. When it works out well. Any other questions that have come up for you all? Okay. Well, thank you all for being here. We really appreciate you coming and asking good questions, and we look forward to hopefully seeing some of your names in our applications. Our applications for fall 2026 are open now. And also, we keep a timeline for people thinking about further into the future. We keep a timeline for when applications are opening and closing on that prospective student resources link on our website. Wonderful. Well, thank you for coming. We appreciate you.
Thank you.
Have a great day.
Bye, everyone.